Very good afternoon. At the outset, I would like to thank Dr. Namrata Sharma, the Chairman Scientific Committee, and the AIOS Scientific Committee for allowing me to use this podium for this very important presentation. This is mainly for the beginners. So, the pearls of financial management for fresh graduates. Well, no financial disclosures. We have divided into three groups, that is 25 to 35, 35 to 55, and 55 to retirement. I would now concentrate mainly on the first age group. Well, here you need to decide the goals and the priorities. If somebody was asking about super specialist training, finish it off. Setting up a professional practice, you need to decide whether you want to open a hospital or just an OPD. And then about the equipments. Residential property, of course, is always a priority, but has to be coming secondary. Insurance, we have to take care of the Mediclaim term insurance. Now AIOS has got FBS and of course the professional indemnity. Investment and savings. Well, last year when I was the president of the Maharashtra Ophthalmological Society, we had conducted webinars throughout the year. Every month we used to have everything about shares, FD, mutual funds, gold and property. Then we have to take care of the two-wheelers and of course marriage. How do we go about it? Office premises, if you have the money, then we have, one is the rental and the second is the ownership. Ownership, you need to have, as you rightly said, bank loans, and then if you have good financial backing, that is angel investors, parents and relatives to help, you pick up a proper real estate agent who has got a good reputation and decide about the property. You need to have proper budgeting. You need to work out the approximate cost of the infrastructure and the instrumentation. If you are a general ophthalmologist, you have a different budget, and as a super specialist or a subspecialist, you have three options. If you are going for an outright buying of the place, and then you install all the equipment, both basic and advanced. Either way, if you have money problems, you go for a rental clinic because infrastructure investment is quite high, and then buy the basic equipment and take advanced equipment on rent, which is going on in metros and mini metros. We have rental equipments available at a meager cost of 600, 1000, 1500. So you can opt for that. Otherwise, you can take a rental clinic and buy all the equipment and installation depending upon what funds you have, all these three options. Now, arranging for the finances, you need to prepare a proper project report. If the bank lends you money, you need to submit a blueprint, how the earnings are and they're going to grow in the next 5 years after taking care of all your expenses. Arrangement of the margin money, usually we require 15 to 25% of the total loan that you are going to ask. They say you take a 1 CR loan, at least 15 lakhs should be yours. You have to generate and pay at the time of the loan disbursement. No bank gives 100% loan unless it is personal or unsecured, wherein the rate of interest is exorbitant. Margin money comes from your savings, your help or loan from a parent, relatives and this. Always go for nationalized bank as the rate of interest is the lowest and there is no hidden charges. Go for moratorium and staggering payment. What does it mean? Moratorium means once you take a loan is disbursed, you have a gap of about 6 to 8 months or a year, depending upon which bank you are trying to contact, where you have to pay nothing, absolutely zero. After that, you start the EMIs. The EMI is also in a staggering way. So if you have taken a loan of 1 crore, and you want to stagger it out and your loan, this thing comes to around EMI is 30,000 as the blanket EMI throughout that period. So you can request the bank to allow you to have 10,000 initially for 6 months, then 15,000, 20, 25 and take a longer period of loans. So that will help a beginner because then the load of finance is not there to payment of the loans. Never take credit card loans as the interest is highest. Just yesterday I paid about 1,000 as just the deposit of not paying 1 day late. 10,000 I had, that was the cost I had done last month and I forgot that date. So I am now paid 1,000. So almost 21 to 36%. Even if you are late by 1 day on the full amount what you have spent, the interest is levied. Don't try to skip EMI as the interest started building up. Initially interest component is more because say you have a 30,000 EMI, the interest component is almost 20,000. They want to collect because if you prepay, they lose on their income. Their main income is interest. So don't try and skip the EMI because then that increases the interest component more and more. They have always take on a daily or a monthly reducing balance as opposite to fixed rate. What does it mean? Every time, every year, 3 months, the RBI comes out with new this thing, so the rate of interest on your loan keeps changing. Say, when I started, I had to buy at 17.5%, which is much less nowadays on a medical equipment. So choose a nationalized bank which gives almost 2 or 3% less than the semi-nationalized and the private banks. There are 12 banks which I have listed. You can take a photograph of this, of the nationalized bank where you can avail it. As I just said, cheaper rates and processing fees are released, but they are poor in services. Of course, they have now relatively improved it. Well, private bank, the loan interest is, the interest is quite high. As I just said now, floating interest rates and fixed interest rates. As it keeps changing, when you have the highest rate of interest when you're buying, and if you feel it's going down, you go for the floating interest rate. Otherwise, fixed rate should be good enough. How to choose? This is what I've written now. Take loans only when you need. At most, as higher interest rates have to be paid higher than the loan amount. Check the interest rates when you buy from different banks. Usually, nationalized bank offer the lowest rate. Try prepaying the loans. If you are earning good, best to prepay the loans. They charge a small penalty, but it is worth it. As an all EMI component, as I said, the interest component is more than the capital amount. Always opt for secure loans, as the interest rates are about 4 to 5% less than the unsecured loans. If you buy an unsecured loan, they'll charge almost 3 to 5% more. Check the interest rate whether on the reducing balance or fixed. Opt for reducing balance, works out much cheaper. So if an EMI, or if you take it on a reducing balance on a 1 lakh loan, if an EMI comes out to be, say, 2,000, if you take it on a reducing balance, it will be almost 1,500. So 500 into 12 into the number of years you have taken. So that is the difference. So always find out that. Take in a staggering fashion, which I have just explained. Take it for the maximum period, then you have a breathing period to repay. Pros is less burden, but cons is you pay more interest if you take a lengthy period of loan repayment. So prepayment, as I said, is a very good option. Budgeting. How do you do it? You find out the day-to-day expenses that you have for the clinic, how much of the EMI you're going to pay, your staff salaries, the margin money required for buying a new equipment, Mediclaim life insurance, professional indemnity, your utility expenses, the telephone, cell phone, MSB, property tax, professional tax, your housing loan in case you have availed the saying house, personal expenses and paying income tax. First, I would always recommend everybody, the fresher, to start paying income tax from day one, because that creates your white corpus. Well, you have the margin money, they see your income tax returns for the 3 years. Always have that. And your savings and funds, mutual funds, shares and gold, I would recommend not to go for the share market for the initial people, because if you have losses, they are tremendous. If you earn, it is also good, but then you have to learn the tricks of the trade. So don't go for shares initially. FDs is first option, but it doesn't beat the inflation. So go in for mutual funds under a proper guidance. Income generation, as somebody was asking, how do we generate income? So OPD, diagnostic and procedures, you try and plan it out. You have to attach to an institute to have a face in the crowd. Then optical shop, nowadays people have it. The contact lenses and low visual aids, generating more surgeries at a discounted rate is very important. Try and have more and more free diagnostic camps. I do it once in 3 months in my clinic for years together. That generates almost the free bola, so lots of people walk in. Out of that, you generate the surgeries, so it does give. Then visiting. For the first 10 years of my practice, I was visiting outside. I am from Pune, so I was visiting about 30 to 40 kilometers outside, and all the pooling was done in my clinic. So that is another way of generating patients. You go to the general practitioners, you have satellite primary setups, and ultimately the tertiary center benefits. Conducting paid subspecialty training, in case you are very good in that subspecialty, start doing it for the general ophthalmologist. And to create a face in the crowd, be on the newsprint lectures, you have radio and TV public awareness programs to create a face in the crowd. Majority of the equipments are very costly, as somebody just said, 2 crores of investment to start with. So buy basic equipment by loans, and rest you can have a group practice. In Maharashtra, we have about 3 or 4 huge group practice, but of course you have to keep your ego outside and you practice. You have a neutral place where you have all the equipment, the advanced equipment. They send the patient there and get it and pay the rentals, whatever is required. 3, now we have people who are moving around in Pune, they rent it out, all the equipment. So we ask them to come to the center and we pay them the rents. Initially, what a basic ophthalmologist should do, if he is a general ophthalmologist, basic is OPD, chair unit, slit lamp, autoref, keratometer, direct, indirect, and tonometer. Rest of the instrument as per your subspecialty. Mainly in the semi-urban, urban, and this is important for the urban and the metro. Of course, you have to have the best of the centers. How do you buy equipment? And when I started my practice, I had a group of friends, 10 to 15. We used to go together by direct lena hai. 20,000 you make a deal for 14, 15 at the conference, pick up and you get it. So almost it is a good deal on that. And if you're alone, if you want to take the seniors, this thing, ask the senior to give a call, courtesy call to the person from where they bought it. They help you in a big way. Overall cost, you have plenty of things. So here, these are the points which are going to cover step by step. Negotiate, negotiate, and negotiate. Leverage the suppliers, buy need, not potential. Trade time for discounts. What each of is, I'll explain you. Buy bargains, reduce waste, replace close to expiry medicines and other consumables, computerize paperless communication, loans from banks, and staff management. Group purchases, as I just said. At individual level also, you try and you negotiate. Use influence of your seniors, as I said. Buy the same product from a vendor and company who's trying to establish. We started with Appaswamy, and I've been maintaining. It's not 10 minutes, it's already 7. Yeah, I'll be cutting. Yeah. Buy the same product from the same vendor who is trying to establish and stick to him. Of course, if he has got inaugural offers, more to it. If the vendor is giving good equipment, product and prompt services, recommend to other colleagues. So next time he'll do a favor to you. Leverage. Do good market research for your equipment. Best time is the annual conference. As vendors from all over the country are available, see the same product, try and tap as many vendors. One who offers at the lowest cost with favorable payment returns. Push that product, tie up with the banks. They usually tie up with banks and non-banking finance and give it at a very low interest because they want to sell their product. As I said, buy need, not the potential. Toyota is one company who saves on inventory. Our main things are IOL, contact lenses, and surgical items. At a smaller center, only keep those items which is really required and fast moving. No unnecessary stock. Those people who are giving you consumables and give you a time period to pay. That is, suppose I have got 100 IOLs, you do stock it. But when I finish, it takes the payment only of that. That helps you in having more time, breathing time. Long-term supply agreement should be done with the vendors. Look for bargains. Best part is those who are clearing old stocks, new models are coming. At the conferences also, many orders are received, new launches of products are there. Closing down vendor businesses, they want to sell off of course, their equipment, whatever they have. Annual clearance sale is there. And best is to do cash purchase. Of course, it's difficult because then you get almost 20-30% discount if you try and do it. Reduce waste in your this thing. Have a monthly inventory and find out what are the expiries and replace it. Otherwise, there's a lot of loss. I have myself faced it. There's a staff shortage. I've missed about 52,000 to 1 lakh of this thing had to be thrown off. So do that. Computerize it, because in computerization, you save on manpower. They don't go on strike. They don't require health insurance. They work on time. It's a one-time investment. Staff management. Multitasking, you try and take as many people who are there, give them incentives. Don't increase the pay, but give incentives. That is another way they'll take more interest. Celebrate their birthdays. This is the offshoot of this. It's short of time, so I'm just running through. Tie up with neutral diagnostic to save on cost without compromising on the quality of surgery. You try and tie up with other centers and neutral ones where you have the OT and the diagnostic setup. Residential property, again, housing loans, the rate of interest is much less than what you have for the professional ones. Loan disbursement is almost 85%, so only 15% is what is required, and the amount is 20 times of your net income. So that's why that white money is to be built up if you want more loans. Insurance, I said, these are the ones that you should take. Investments, start doing with the FDs first. The non-banking corporate FDs, they give almost 2% more than the regular FDs. Mutual funds and shares should be the last. Vehicle, as far as possible, try and avoid initially. Move on a two-wheeler if it is close by. Otherwise, buy it. And they also give you the non-banking at a lower interest. marriage, almost 5 years of practice. After that, I think you should step in. Otherwise, it will be a big stress. Having a partner not able to take care of her, and plus you have the professional practice. So my recommendation is 5 years down the line. So have full financial prudence while setting up your practice. It saves a lot of hard-earned money. Buy only when you need, not what you want, because you are going to build a white elephant. Save first and then pay off your EMIs. Don't miss your EMIs. Pay your outstanding loan as early as possible. If you have constraints, go in for the rentals initially before you have your own corpus. Thank you very much.